Hello everyone. In this video, we are going to review the Hamilton Depression Rating Scale, also known as the HAM-D. So this depression rating scale actually dates back to 1960, believe it or not. So before we even landed on the moon, this depression rating scale came into use. The reason I think it is worthwhile to review and to consider incorporating into your practice is it is still heavily used in research. So if you're thinking of maybe doing some data mining, going back doing some retrospective chart review, or even doing a prospective study, HAM-D is certainly one of those rating scales that is in common use in the depression research and could certainly be more useful compared to other rating scales such as the PHQ-9. So going through, there are 21 areas or questions that are covered in this, the first 17 of which are scored. So the last 4 items you do not actually include in the final score, but you still ask about them. So starting out, question number 1, depressed mood. So gloomy attitude, pessimism about the future, feelings of sadness, tendency to weep. So 0 absent, 1 sadness, 2 occasional weeping, 3 frequent weeping, 4 extreme symptoms. Number 2, feelings of guilt. So 0 would be absent, 1 self-reproach, feels he, she has let people down. Number 2 would be ideas of guilt, up to 4 having hallucinations of guilt. 3, suicide. So 0 absent, all the way up to 4 being attempting suicide. Insomnia is heavily focused on here, and it actually breaks it down into initial. So for number 4, talking about initial insomnia. So 0 for absent, 1 for occasional, 2 for frequent. Middle insomnia, so complains of being restless, disturbed during the night, waking during the night, rating it from 0 to absent all the way to 2 frequent. Number 6, insomnia delayed, so waking in early hours of the morning and unable to fall back asleep, also known as terminal insomnia. So again, rating it a 0 if it's absent or 2 if frequent. 7, work and interests. So 0 would be having no difficulty in these areas, having a score of 3, would have productivity decreased, or 4, unable to work, stopped working because of present illness only. Absence of work after treatment or recovery may rate at a lower score. Retardation, so having slowness of thought, speech, or activity, apathy or stupor. 0 being absent, 1 slight retardation on interview, 2 obvious retardation, 3 interview being difficult, and 4 being in a complete stupor. 9, having agitation, so restlessness associated with anxiety, again 0, 1, or 2, depending whether it's absent or frequent. Anxiety, so having 0, no difficulty, 1, tension or irritability, 2, worrying about minor matters, 3, apprehensive attitude, 4, having full-blown fears. Moving on to number 11, somatic symptoms, so having GI, indigestion, cardiovascular, palpitation, headaches, respiratory, again, rating from 0 all the way to 4, being incapacitating. Moving on with more somatic symptoms, so loss of appetite, heavy feeling in the abdomen or constipation. Continuing with somatic symptoms, having heaviness in limbs, back or head, diffuse headache, backache, loss of energy, and fatigability. Having genital symptoms, so loss of libido, menstrual disturbances, again, rating between a 0 and a 2 for severe. Number 15, hypochondriasis, so having a score of 0 would be not present, 1, self-absorption, 2, preoccupation with health, 3, querulous attitude, 4, hypochondriacal delusions. So 3, for those who don't know, querulous definition being complaining in a petulant or whining manner. So some room for subjective interpretation here, but at least wanted to cover what that definition is, as maybe some of you have never heard that word querulous before. 16, weight loss, so 0 being no weight loss, 1 slight, or 2 obvious or severe. The line of demarcation between slight and obvious or severe is not readily apparent or obvious. I think a good rule of thumb could be maybe in the 3 to 5 pound range as being slight. Obvious or severe might include having to buy new clothing, or having extremely baggy clothing, or the patient or family members spontaneously bringing up weight loss as being an issue Those could be some helpful tips in maybe differentiating between those two groups. Number 17, insight. So insight must be interpreted in terms of patient's understanding and background, 0 being no loss, 1 being partial or doubtful loss, and 2 being loss of insight or complete loss. So for the actual final score, you are adding up the total in items 1 through 17. And these various designations here include normal, being in the 0 to 7 range, mild depression 8 to 13, moderate depression 14 to 18, severe depression 19 to 22, and being over 23 or 23 or greater, very severe depression. I think differentiating between severe and very severe probably doesn't have many clinical applications other than tracking the final number with whatever intervention is chosen, and hopefully that number goes down over time. Items 18 through 21 are not included in the final score, and these items include diurnal variation, so symptoms worse in the morning or evening, and then noting which one it is, so 0 having no variation, mild variation versus severe. Again, probably some room for rater subjectiveness, but try and do your best. Depersonalization and derealization, so 0 being absent, 1 mild, 2 moderate, 3 severe, 4 incapacitating. Paranoid symptoms, 0 being none, and all the way up to 4 having persecutory delusions, and 21 obsessional symptoms, 0 being absent, 2 being severe.